Welcome to Pre-Reg Shortcuts, the #1 pre-reg online training platform with over 85% student pass rate, 100% money-back guarantee on some of our products. Study from the comfort of your home. Outstanding customer service. 30+ B&F, MEP and calculation videos. 100+ up-to-date GPhC style questions. Welcome to Pre-Reg Shortcuts, the #1 pre-reg online training platform with over 85% student pass rate, 100% money-back guarantee on some of our products. Study from the comfort of your home. Outstanding customer service. 30+ B&F, MEP and calculation videos. 100+ up-to-date GPhC style questions. Welcome to Pre-Reg Shortcuts, the #1 pre-reg online training platform with over 85% student pass rate, 100% money-back guarantee on some of our products. Study from the comfort of your home. Outstanding customer service. 30+ B&F, MEP and calculation videos. 100+ up-to-date GPhC style questions.
Hello, everybody. Hello. If you can see me, please type yes. If you can see me and if you can hear me clearly, please type yes. Please type yes if you can see me and you can hear me clearly. Let's make sure everyone is logged in and then we can start. Okay, Kate. Hello, Kate. Evening all. Hello, everybody. If you can see me clearly, please just type a yes. Let me just make sure I'm not talking to myself, but I'm talking to everyone out there. So thank you all of you that have logged in today. Quenda Roselyn, how are you? Jacob, nice to see you. If you're here for the first time, please type 1 so I could give you a shout out today. Kuda Kwashi, good to see you on there. Jacob, so we've got about 76 of us on Facebook. I cannot see the YouTube comments yet. So share with Daniel, welcome. I've got, what else have we got? Well, I've got a few names. Got Shala. How are you, Shala? So I've got a few ones coming up. So good vibes. Yvonne Chances, good vibes. I can get all the YouTube as well. Simzi, Ala, Emilia. Those of you writing 1, Ala, Simzi, Emilia, I just want to welcome all of you to an amazing evening of learning. We're going to cover hypertension today. Those of you that have not been to any of the other sessions, please, you could visit us, log into YouTube. You have got all the videos on there that you've missed so that you could catch up with anything that you've missed. Hello, Prosy, and welcome. You're here for the first time. So what we're going to do today is I'm going to go through what we're going to cover. So I just need to share my screen. Okay, so I'm sharing my screen. If you can see the screen clearly, please just type in 1 because now I cannot see your comments. But if you just put 1, then I just want to make sure everyone can see the screen. So for today's agenda, what we're going to cover, we're going to look at hypertension, risk factors of hypertension, thresholds and targets, drug treatments. So we're going to use obviously the updated NICE guidelines, which is a bit different from the BNF because the BNF, I'm going to go through that later. But the BNF is not as updated. Most of the guidelines are from 2011 for hypertension, but we're going to make sure that we focus on the most up-to-date ones, which are obviously 2019 NICE guidelines for hypertension. And then, as always, we're going to end up with exam questions. Okay, so I'm going to give you about 7 GPhC style questions to test your knowledge to make sure you can apply the knowledge. So let me just get the screens up so I can see. So a couple of people on YouTube. Cannot see all the comments coming up yet on Facebook. If you're on Facebook, just give the video a like. If you're on Facebook, you can share this as well, like we normally request. So we don't ask for anything apart from asking you to please share this with friends. That's all we ask for. And from YouTube, give the video a like, write a comment, and then we can start. So hypertension is extremely important. And one of the reasons why it's so important is because you normally get at least 1 or 2 questions in your exam. Right. So, and then in terms of being a pharmacist, it's also very important in terms of you see these medications every single day, and a majority of your patients will be on blood pressure tablets. So let's look at what we're going to cover is exactly what you need, the key things for your exam. So the first thing I'm going to ask you, first question, those of you who have not been here before, the sessions are very interactive. So if you guys could just write down 3 common ways. So the first thing you need to know are the 3 common ways in which we measure blood pressure. So if you guys could just write down the methods, so the 3 common ones, and 3 types of blood pressure readings. So you need to be familiar with all 3, and you also need to know your values, your targets, and then you need to know how to interpret blood pressure results, what to do. You need to know when you just have to advise, when it's just going to be lifestyle advice, and you need to know when patients will be put on medications. So I cannot get I'm not seeing the Facebook comments now. Unfortunately, I'll probably have to refresh my my screen, but I can see a lot of YouTube ones. So I've got from reading from YouTube, I've got clinic, I've got home, and ambulatory. So the 3 main methods that you need to be aware of in terms of blood pressure measurements. So those are your 3 types. So you got what we call clinic, which is essentially when your blood pressure is taken in a clinical setting. So this could be by a doctor, most commonly, and that's what we talk about, the white coat syndrome. So clinic blood pressure is when your blood pressure is taken by a doctor, by a physician, and with these readings are normally higher than the ambulatory and the home blood pressure methods. So ambulatory methods is just a 24-hour monitoring. So with the ambulatory, you get this little device which is sort of stick it on you. So I've got a picture there on your right, and it's a gentleman that's got a little pouch on his left side, on his right side, and that pouch, that is your ambulatory, and it monitors your blood pressure throughout the day for 24 hours. And then you have the final one at the bottom, which is your home monitoring method or home machine. And this is the common one that you probably have in, say, your consultation rooms, okay? So that's your HBPM, which is your home blood pressure monitoring. And then you've got ambulatory, which is a 24-hour monitoring, which you stick that on you, and that records your blood pressure throughout the day. And then the top one is your clinic, where you have the blood pressure taken by a physician or in a clinical setting. So you need to be familiar with all 3. They normally come up in your exam. They might ask you for clinic, or they might present you blood pressure readings in terms of your clinic results, or they might give you as ambulatory. So it's important that you know clinic and you know ambulatory as well. Is that okay? Right, so the next one, so what are the risk factors? You need to know all your risk factors for hypertension. So you've got what we call modifiable risk, and then you have those that are not modifiable, okay? Most of the risk factors might be lifestyle, and then you have those that literally are, say, different factors that you cannot modify, you cannot change them. So can you guys just write down, just type down what the common risk factors are for hypertension? So if you just type down the risk factors, said I'm still trying to get the stream on Facebook. I know it's going on Facebook, but I'm just trying to get that. I can't see your comments. But on YouTube, I'm getting all links. So on YouTube, I've got family history, which is a non-modifiable factor, age, non-modifiable. And they got things like obesity, which is modifiable, being sedentary. In Ketchibam, Hita Patel says obesity, Audrey says age, Joshni, diabetes, sedentary, family history, and Chichi says smoking, family history, weight. So these are, yes, so these are the main risk factors which you need to be aware of. So these are things that could increase your risk of getting hypertension. So risk factors: age, ethnicity, dietary, salt, exercise, alcohol, caffeine, smoking, weight gain. These are the common risk factors. You also have what we call secondary causes or risk factors. So these are ones that are caused, say, by endocrine cause, for instance, hyper or hypothyroidism, or it could be from a renal disease, so probably from one of your organs. Okay, so this could also say any condition that you have, say renal disease, that could also increase your blood pressure. So these are what we call secondary causes. So what I'm going to do for you guys today is I'm going to go through exactly how you need to study this chapter. I'm going to show exactly how to learn hypertension, and I'm going to make it really easy for you. Okay, so there's some key terms that you need to be familiar with, because when you get to using the guidelines, you need to learn the guidelines. They're so important. They normally come up in exam questions. So before you start reading the guidelines, you need to understand definitions. So do you guys know what established cardiovascular disease means? So what is established cardiovascular disease? What do we mean when we say established cardiovascular disease? So what do we mean by established cardiovascular disease? Let's see what you guys have. So it's a very important term. The reason why I need to be familiar with this is because you're not going to understand the NICE guidelines if you don't know what the definition of this is. Okay, so once you understand this definition, that's going to help when we get to NICE guidelines, you see why it's so important. All right, so let's see, I'm still not getting your YouTube comments, unfortunately, but I'm sure that's going to come on soon. So Firestarter says known CVD event history. Hetal Patel says MI. Your Asamoah, if the person's conditions such as AF, such as ACS. Okay, yeah, so the common ones, and I've got blood vessels. Hosner says affects heart and blood vessels. Good. So the main ones you're looking at, any when we talk about cardiovascular disease, we're talking about anything where you have, say, fatty acid deposits in your arteries, and so that stops the flow of blood. So you're looking at things like a medical history of stroke, a TIA, which we covered last time, a mini stroke, heart attack, angina, and anything that narrows your arteries and that will prevent the flow of blood going through your key organs like your heart or your brain. That's what we call cardiovascular disease. So it's important that you know that, because when we get into the NICE guidelines and start explaining to you the NICE guidelines, this term is going to come up. Okay, so another key definition you need to know is what we mean by target organs. Do you guys know what target organs are? So if we say target organ damage, what are we referring to when we say target organs? So if you just want to type that down, if you're just logging in right now, give the video a like, give a love heart, and it's very good to have you. We're going to cover very important. I said everything we're covering today has a very high chance that something from here will come up in your exam. So I've got kidney, eye, and heart from Emilia. Audrey says kidney and eye. Hosner says brain and heart. So you guys are correct. So I'll give you you don't have this on the course. As many of you are on the course, and those of you that are interested in the course, you can still enroll on our course where you get detailed notes, right? So on the course, I didn't have this acronym, but I put this later on. So those of you that are on the course, you could add this to your notes. So I use heartbreak. Okay, heartbreak simply means your heart, BR, your brain, okay, BRA, your brain, K for kidney, and E for eye, retinopathy. So when we talk about target organs, we're looking at heart, brain, kidney, and eye. All right, learn these organs. Again, when we start looking into NICE guidelines, these key definitions will be important for you to understand the guidelines. Okay, Thomas says, Marvin, please, can you make course available in smaller installments? Yes, you got installments for the course. You can pay installments. You could email us after that, Thomas, and I'll explain to you how we can arrange that. Okay, so definition. Let's look into the NICE guidelines. It's so important that we look at definitions. Okay, if you guys are really serious about understanding this chapter, then NICE guidelines, you need to read your NICE guidelines, because that's going to provide you the most up-to-date information. So 3 things you need to know. You need to know that there are different stages of hypertension. So we have what we call stage 1, stage 2, and stage 3. or severe hypertension, you need to know what the stages are, and you need to know what the results are, or the blood pressure readings at each stage, right? So question number one, what is stage 1 hypertension? You need to know clinic blood pressure. You also need to know the ambulatory readings. So so you guys want, what is the clinic? So let's focus on clinic first. So stage 1 hypertension, what is the clinic value? Now, if you don't know anything, if you don't know what these are, if you don't know the values, please just type in 0. Because I like to know who doesn't know as well. It's going to help me to know how much explanations I need to give to you. So if you don't know, just type 0. If you do know, then put it down. So I've got 140/90 from Lorraine, from Emilia, from Faisa, Doris as well. Good. So yes, the main thing is it's 140/80. So it's equals or greater than 140/90, right? So the best way to learn this is, and I showed this in the course, is that you just need to add 20 at the top and 10 at the bottom, and you'll get through the different stages. So your normal high blood pressure or normal blood pressure reading, it's 120/80, okay? Right, 120/80, that's what you should be on. That's a good blood pressure reading. Now with hypertension, if you add 20 to the top of 120, you get 140. And if you add 10 to the bottom of 80, you get 90. So add 20 to the top and 10 to the bottom, and you get the next stage. All right. So you take a normal blood pressure 120/80. That's all you need to learn. That's all you need to memorize. And then add 20 to the top, 10 to the bottom. That's stage 1, 140/90. Stage 2, you do the same thing. You add 20 to the top, that'll be 160. And then you add 10 to the bottom, which is going to be 100. So that's a quick way to remember, to learn your different stages. So stage 1 for clinic, and this is just for clinic, okay? So for clinic blood pressure, 140 greater than or equals to 140/90. That's stage 1. Stage 2, add 20 to the top, you get 160, and add 10 to the bottom, you get 100. So greater than or equals to 160/100. And then severe or stage 3, you add 20 to the top, you get 180, 10 to the bottom, 110. So that's a good formula that you could use to remember all your clinic values. You need to also learn the ambulatory, especially for stage 1. Okay, 135/85, because GPhC might give you ambulatory values or they might give you clinic. So it's important you know the difference. Is this clear? If this is clear, type in 1, type in 1, type in 1. If this is clear, you understand this, you can apply this, please type in 1. Great stuff. Okay, so know your different stages, 1, 2, 3, and know the values, learn clinic and learn ambulatory. So what normally happens, the next thing you need to know now, this is very important, absolutely important. This is where many students get confused. The thing about this area, hypertension, it's very small, but there are many factors in there that get a lot of people confused. And that's why the GPhC likes asking questions on this, because you could ask many different types of questions and there are many traps. But I'm going to show you guys all the tricks, all the tips. So if any of these questions come, I could guarantee you 100%. If you apply what's in these notes, you're going to smash the questions. All right. So when do you start? So what we're going to look at now is, when do you give medication to someone? Okay. So when a patient comes to see a doctor and they've been diagnosed or they've got some blood pressure readings, when do you give drug treatment? When do you give medications? And when do you just advise them or give them lifestyle advice? So the next thing we're going to look at now is, how do you decide whether to give someone medications or whether just to give them lifestyle advice? That's what we're going to look at now. So when do you start drug treatment? So let's look at the first thing we're going to look at is stage 1. Stage 1 is the most complex one, in the sense that there are different factors, different things that you need to know to make that decision. But stage 2 and stage 3 are quite easy, because with stage 2 and stage 3, regardless of the age or what the age, the ethnicity, you give them the medication. But stage 1 is the one that you guys need to be very careful with. So let's look at stage 1. So the reason why stage 1 is different from the others is because having stage 1, having a high blood pressure, doesn't necessarily mean you need to put them on medication. Okay, so there's certain patients that will have a high blood pressure reading, they'll have stage 1, but then you don't put them on medication, you just give them lifestyle advice. And then you've got others that will have the same reading, but then you have to give them medication. So that's what we're going to go through. You're going to see those that don't need medication and those that need medication, just in case it comes up in an exam question. So stage 1 hypertension, the first thing I've got highlighted in red is when we talk about hypertension, we're looking at persistent results, okay? Persistent hypertension, not just a one-off reading. So when you go to the doctors, they will measure your blood pressure. If it's high, they will send you home to do a home blood pressure monitoring or ambulatory monitoring, do a number of measurements, and then bring the results back. And that's when you can tell if it's persistent. That's when you can say they've got hypertension. So the first part, we're looking at stage 1 hypertension. And this is just stage 1, guys, so that you don't get confused. Because if you don't know this, you're going to get confused. When I was studying, I used to get confused with these things. But I'm really making this easy for you now. So only stage 1. That's why stage 1 is different from the others, because you need to know a few things. So the first thing you need to look at stage 1 is we've defined what stage 1 is. It's 140/90. So anything from 140/90 all the way to 159/89. Okay, that's stage 1. So when you look at stage 1, you also look at the age. So the first column you've got there on the left, the first table, it's less than 80 years old. So with stage 1, less than 80 years old, greater than 80 years old, less than 40 years old. That's why I said this is the most complex of all the stages. But once you understand this table, you're going to be in a very good place. So when someone, I'll give an example. If someone has a blood pressure reading of, say, 140, or say 140/90, the question is, how old are they? That's the next thing. If they're less than 80, you don't need to put them on medication. You could just give them lifestyle advice. However, if they have any of these conditions, so if they've got a blood pressure 140/90, but they also, in addition to the blood pressure, they also have a target organ damage. So do you guys see why that's important? I said you need to know the definition because it comes in the guidelines, and this is where it comes in. If they've got target organ damage, if they have one or more of these, target organ damage, if they've got established cardiovascular disease, which we've covered, if they've got renal disease, diabetes, a 10-year risk of cardiovascular disease of greater than or equals to 10%. If you look at your BNF, it says 20%, but the recent guidelines have changed it from 20% to 10%, right? So if a patient has got blood pressure 140/90 and they've got any of these, one or more of these, then you put them on medication. If a patient has got the same readings, 140/90, but they don't have any target organ damage, they don't have any of these things, established cardiovascular disease, they don't have any renal disease, you don't put them on medication, just lifestyle advice. And you check them every couple of years, okay? So that is a very important difference, and you need to know that's less than 80. Please learn this stuff, guys. If you learn this stuff, I'm saving you a lot of time here. I'm saving so much time, so much stress and confusion, okay? Then the next thing, that's less than 80 years old. If they're above 80 years old, then they have a different clinic measurement, okay? So if they're more than 80 years old, it's a bit higher. So if they're greater than 80 years old, the target clinic is 150/90. If they're less than 80 years old, it's 140/90, like we said. But for patients that are greater than 80 years old, the target is 150/90, and ambulatory is 145/85. And if any of the patients that's greater than 80 years old has a blood pressure that is greater than 150/90, then you give them drug treatment. If they don't, then you can still give lifestyle advice. Then you have what we call patients that are less than 40. The reason why they have a separate category of less than 40 is because normally you wouldn't expect patients that are less than 40 to have high blood pressure. So if a patient's got high blood pressure, they've got hypertension, they've got, say, high blood readings, maybe 155/95. If they've got a high blood pressure reading, the GPs normally investigate for any target organ damage to see what's causing the hypertension. If that happens, if there is no target organ damage, but someone that's less than 40 has got a high blood pressure with no target organ damage, then a further investigation needs to be done to determine a secondary cause, right? To see exactly, you need to investigate why someone that's less than 40 with no target organ damage still has a persistent hypertension, a persistent high blood pressure. Does this make sense? If this makes sense, just type in 2, type in 2, type in 2. The different things to learn, but I'm taking my time because I want you guys to understand this table, look at these notes again, but you need to learn this stuff, right? If this makes sense, give it 2. I said it's the most complicated part. I'm getting 2s coming up, which is quite good. If you understand this stuff, you'll be able to answer a lot of questions in the exam and you wouldn't be confused. So that's for stage 1 hypertension. And I said that's the most difficult part. The good news for you is that the next ones, you give them medication regardless. If anyone has got stage 2 hypertension, so that's hypertension systolic, that's greater than or equals to 160 over 100. If anyone has a blood pressure reading, hypertension, stage 2 or stage 3, you give them medications regardless. So you don't need to check whether they've got target organ damage and all of that. As long as that's high, regardless of the age, you give them medication. Is that clear? If that's easy and that's clear, give me 1, give me 1, give me 1. Normally for very severe hypertension, then you probably give IV medications, okay? Because that's an emergency. With emergencies, you will normally give IV, okay? If that's clear, give it 1. So the main thing you need to learn stage 1 and learn the different things that determine whether you need to give medication or not. When it comes to stage 2, you don't need to worry, or stage 3, you give them medications regardless. You'll never get this more simplified than this, guys. I've really simplified this for you. I've saved you a lot of time, a lot of revision, saved you a lot of stress, a lot of confusion. So looking into your exam, into the sort of ways that the GPhC asks you questions, because it's pointless just reading your BNF without knowing how to apply that knowledge, right? So what I try to do is I give you notes, but my notes are really geared towards your exam, all right? These notes are really geared towards the exam. What I mean by that is that you look at this note, you go to answer past questions, and you'll see a lot of the things coming up in here, right? So let's look into what drugs are used. You need to know the different steps. Now, you need to know the different steps in the NICE guidelines, right? For hypertension, you need to know the different steps. You need to know each of the drugs that are involved in each step. And then also, so important, you need to know about the side effects of the drugs. You need to know about the quotients of those drugs, because that's where they ask you questions, and that's where they try to trap you. So just ask you guys, what drugs, right, are used in the treatment steps of hypertension? Do you guys want to type down the drugs? So I've got Allah that's asking what if the patient's over 80 with target organ damage. If they are, then you will give them medication. You will give them medication, Allah. Right? So the patients that are over 80, you will. And most patients that are above 80, most of them are already on medication. Okay, so if they're already on medication, then that's fine. Okay, you just continue. So those patients that are like 79, if they're already on blood pressure tablets, by the time they get to 80 and over 80, you don't take them off. They keep taking those tablets. But I said, if they have any organ damage, you will put them on medication. So Emilia says calcium channel blockers, ACE inhibitors, ARBs, diuretics. Nkechi says, please, what's the target value for patients greater than 80? So we've gone through that. So let me just show you patients that are greater than 80. We have it. The target value is, it has to be less than, target clinic is 150 over 90. Okay, it has to be less than 150 over 90. If it's higher than that, then that's obviously when you put them on medication. So right, so I've got ACE inhibitors, ARBs, calcium channel blockers from HETA. Audrey says the same ACE. Good, so we guys are getting that right. Okay, what is the target BP for a patient with both hypertension? So someone's asking, what is the target BP for a patient with both hypertension and diabetes if they're under 80? I'll come to that. So I'll come to hypertension and diabetes. That's important as well for you guys to know. We're going to look at that very shortly. So so you guys all know the groups. So the code is ABCD. All right, so ABCD is what people have used for many years to remember the drugs that are used for hypertension. Now, there's a reason why I've put beta blockers with a big question mark. Because previously, if you look at the old guidelines, we used to follow ABCD. But if you look at recent NICE guidelines, there's been many question marks about beta blockers because they've got a lot of interactions, okay, with beta blockers. So they're not as safe compared to other drugs. So what's really happened is they've gone down the pecking order. So beta blockers are not at the top anymore. They're literally at the bottom now of your NICE guidelines. And if you look at the recent NICE guidelines, although the BNF probably still has the old one, because BNF still has 2011, but if you look at the recent NICE guidelines, you will see that the beta blockers is literally ACDB. Okay, so it's not ABCD, it's ACD, and then B comes at the bottom. Okay, very important you know that, but I'm hoping that in the exam, they'll probably give you an SPC. So you have to use whichever SPC you have. So if they take a part of the BNF and they ask you questions on that, you need to answer based on the SPC, which I'm going to do something on SPCs. I'll show you guys how to smash SPCs, very good tricks and techniques. But depending on what they give you, if they give you a nice guideline, an extract from a nice guideline, then you have to use that to answer the question. But you need to be aware that what you have in your BNF is different from the recent NICE guidelines. All right, so we've got for purpose, we're going to use A, B, C, D. But remember, beta blockers are not, they've gone down the pecking order. So this is what you need to do. So with each medication, with your ACE inhibitors, your ARBs, your beta blockers, calcium channel blockers, and diuretics, you need to know certain things about each of them. Because once you know those things, you're going to be able to answer a lot of questions. So you need to know what the drugs are. You need to know the steps. But most importantly, you need to know contraindications and cautions and side effects of each of those drugs or classes of drugs. You need to know those. Absolutely important. And we're going to do some questions later on, and I'm going to show you how to apply that knowledge. So when the GPhC is going to ask you questions, they're not just going to ask you calcium channel blockers, what's the next step? Okay, patient's taking an ACE, what's step number 2? And you go, all right, I'm going to add a thiazide. It's not going to be like that. They might give you some contraindications, some cautions, and that's going to make you think, oh, I cannot give this. I need to give this other medication. So what I've done is I sent to all the students on the course, on the Telegram group, I sent out a table today, and that table is a summary of all these things that are so important. So what I've done is this table that you guys see over here. All of you on the course, you've got this table. It's in Telegram group. You could access it. You could download. You could do whatever you want to do with it. But what I have in this table is so important. This table, if you learn this table, you'll be able to answer a lot of questions, because these are where the GPhC tries to change things. So ACE inhibitors, you need to know which patients need to avoid ACE inhibitors. So they might give you a question and they might mention the Afro-Caribbean. They want to make sure that you know that you don't give them the ACE inhibitor, you give them the next medication, the next step. All right, so Afro-Caribbeans, ACE inhibitors, you need to know about the side effects. Coughing, they might give you a scenario where a patient has a cough and you need to give them an alternative. So there's all of these things that you need to learn, but this table has put everything together, summarize everything for you. ARB, you need to know hyperkalemia as well. They might give you questions, but with blood results, and the patient might have a high potassium level. So you need to know your potassium levels. It might be a patient's got heart failure. You need to know that's contraindicated. Calcium channel blockers are contraindicated. So this table that you have here is gold, right? This table I put for you is absolute gold, guys. And all of you on the course, you've got this table, but this table is going to help you answer so many questions. So let's look at the guidelines. Okay, I'm going to go through the guidelines very quickly, but it's quite simple. It's very simple. Guidelines, learn your guidelines. 2019, this is the most up-to-date guidelines for hypertension. So the first thing you need to know, the two sides, okay? Make it easy for you. You start off with patients that have got diabetes, type 2 diabetes, right? So any patient that's got hypertension that has got diabetes, watch out for that in the exam. Because I put a question on the other day on the website, on Facebook, and many people got this wrong. And the GPhC has had this question in one of the exams as well. So be very careful. Now, this is where people get it mixed up. So any patient that has got type 2 diabetes with hypertension, they're treated different, regardless of whether you're Black African or whether you're Caribbean. It doesn't matter, okay? If you've got hypertension and you're type 2 diabetic, you normally start up with step 1 with ACE inhibitors. All right, you give them ACE inhibitors. It doesn't matter if they're African Caribbeans. That's the first trap. Right, when I ask this question, many people go, "Oh no, they've got diabetes. Doesn't matter if but the African Caribbeans, so they cannot have an ACE inhibitor, ARB." No, not for diabetes, because ACE inhibitors help to protect your kidneys. Okay, you need ACE inhibitors because they have an advantage for only patients that have got diabetes. All right, nephropathy, it helps to prevent diabetic nephropathy. Okay, so it's so important that you know that. Don't mix that up. Don't look at one of those questions and go, "Oh, some ACE inhibitors, we cannot give them to African Caribbeans, so we cannot give ACE inhibitors." Not if they have diabetes. So, and with ACE inhibitors and ARB, the recommended, the NICE guidelines recommends that between those two, the ARBs are better than the ACE. So if you have to give someone an ACE inhibitor or an ARB, the recent NICE guidelines say go for ARBs, especially for African Caribbeans with diabetes. Step 2, so step 1 is using one drug. So you just have to remember that step 1 is one medication, one drug. So you could either start off with an ACE or an ARB. This is just for hypertension with type 2 diabetes, okay? The second step 2 drug, so you could either add a calcium channel blocker or a thiazide-like diuretic. And the third step is all three, an ACE inhibitor or an ARB, calcium channel blocker, thiazide diuretic, thiazide-like diuretic. Please learn this stuff. And then the final stage was, well, step 4 is normally when you've tried everything, you've optimized the dose, it's what we call resistant hypertension. This is where your calcium channel blockers come in. So with the last stage, you give them spironolactone, okay, low dose spironolactone. But at this stage, at the bottom there, I don't know if you guys can see because I think my sharing thing is covering that a little bit. But you need to look at the potassium levels, okay? So if a patient has got a potassium level that's higher than 4.5, then you can either give them an alpha blocker or beta blocker. So beta blockers now come down the pecking order. Previously, you have a beta blocker after your ACE, like step 2. You have an ACE inhibitor, then stage 2 will be B, a beta blocker. Not anymore. Not anymore. You guys can see clearly on the recent NICE guidelines, beta blockers have been taken off. So hypertension, so that's hypertension with type 2 diabetes, regardless diabetes, that's what you do. All right. So now hypertension without diabetes, if you have a patient that's got hypertension but there's no diabetes involved, that's when you need to look at different factors. You need to look at the age, you need to look at the ethnicity. Okay, but if they had type 2 diabetes and hypertension, you don't have to worry about looking at the age and all of that stuff. They all follow the same sort of steps. Okay, but if there's no diabetes, then if the patient is less than 55 and is not African Caribbean, then you go through the same steps that you will go through with someone that has got type 2 diabetes. If the patient is over 55 and the Black African or Caribbeans, then you give them a calcium channel blocker, step 1. Step 2, calcium channel blocker or an ACE, or you could give them calcium channel blocker with a thiazide-like diuretic. And then step 3, all three, and it follows the same like the other steps. Is this clear? So you just have to learn this, but I said the main thing you need to learn is learn about diabetes, don't get that mixed up. And then you need to know about contraindications. You need to know when to avoid. So you might have, for instance, step 1, you start with a calcium channel blocker, but step 2, you cannot give an ACE for some reason, or you cannot give a thiazide diuretic because that patient has got something which causes thiazide diuretics to be contraindicated. And that's where the GP is going to ask you questions. But as I said, we're going to do some examples at the end that are going to make it clearer for you. So is this all clear? If this is all clear, give me a 2, give me a 2, give me a 2. Give me a 2. So those of you on Facebook, I'm not ignoring you. It's just because my Facebook isn't coming up for some reason. So I'm mainly reading comments from YouTube. But remember, guys, you can always leave a question in there for me. And after this, I'm going to answer all your questions individually. So I'm getting a lot of 2s, which is very good. I'm getting a lot of 2s. Let me see if I could go check on Facebook as well, if I could try to get you guys on. Okay, so I'm getting a lot of 2s on YouTube, which is great. So I'm going to move on to the next phase. So hypertension, what is the target? The main thing you need to know as well is hypertension in diabetics. And I think someone asked that question earlier. What was the target for someone who's got hypertension and that's also diabetic? What do you guys think the target is for diabetic patients? You want to type that for diabetic patients. So Adelaide Seller, Yo, Hosna, Kechi. So Chichi says 140/90. Emilia says 135/85. For clinic blood pressure, guys, clinic, be very careful with this one. I'm getting loads of 140/90. And I've got Firestarter that says 130/80. I've got Hosna that says less than 140/80. Yeah, so with your targets with diabetes, remember we mentioned non-diabetes, we spoke about 140 for systolic over 90, right? It has to be less than that, anything above that target, then it's hypertension. With diabetic patients, it's similar, but rather than 90, you have 80. Okay, so the target is to keep them less than 140/80. That's what you have as your target for hypertension in diabetic patients. While for normal patients, we have 140/90. For diabetic patients, it has to be less than 140/80. If that patient has a kidney or cerebrovascular disease or any eye problems, then it has to be less than 130/80. And these are for clinic values. So please learn this stuff. So you need to know about your diabetic patients with hypertension. You need to know about normal patients with hypertension. You also need to know about pregnant ladies with hypertension. Okay. Great. So someone says, but the new guidance has now changed. Well, this is the most recent guidance. So yes, it's changed from literally almost every year you have something added to this. So this is as new as August 2019. I don't know if there's been any change in the last month. I doubt it. But what we have now changes up to August 2019. I don't think anything has been done after that. So which drugs are used to treat hypertension in pregnancy? Another important one I need to know, exam question. Hypertension in pregnancy, do you guys want to put out which drugs can you use to treat hypertension in pregnancy? All right, it looks like I finally got got Facebook. Right, yeah, so I've got Facebook finally. Great, so I could speak some of your face. Share with Daniel, 130/80. Good, I've got the comments finally. I've got about 100 comments from Facebook. I can't go through all of them now. But yes, good, I'm seeing all your comments. Kate, right, Kate is back in the 130/80 with comorbidities. All right, okay, I think it's a bit so. Yes, I'm getting labetalol, I'm getting nebivolol. I wouldn't say nebivolol. I'm getting labetalol, calcium channel blockers. Okay, great. So you guys need to know which ones are used in pregnancy, and I'm going to show you the list. So you have labetalol, which is first line, metal-dopa, and MR-nifedipine, right? Which is not on license, but that's an option. It has to be MR-nifedipine, not just normal nifedipine. Don't mix that up. Sometimes the GPhC might trap you. They might give you nifedipine, and you might get that wrong. It has to be MR-nifedipine. Great. So yeah, I'm getting the same answers as well on YouTube, which is fantastic. I've got hydralazine. I wouldn't put that there. No, I'm going to go through. These are the three main ones: labetalol, metal-dopa, and MR-nifedipine. Right. So that's it. We're going to go to the questions now. Are you guys ready for questions? If you're ready for questions, give me yes, give me yes, give me yes. Type in yes if you're ready for questions right now. So these questions are going to help you to apply all the knowledge. And these are the sort of questions GPhC is going to ask you. I'm getting yeses, yes. Audrey says yes. Hosna's yes. Emilia, yes. Lauren, yes. By the way, if you guys are enjoying this, if you're learning anything new today, please just type in 1. If you've learned something, you thought, wow, I did not know this stuff, I know now, just type in 1. Great. It's gone way too quick, Doris says. Yeah, it has gone way too quick. It's almost an hour. Again, loads of ones. Brilliant. I want you guys to learn stuff. As I said, everything is geared towards your exam. And when you do those past questions and when you get into your exam, I can guarantee 100%, I'm that confident that I know that these things will come up. It's the same with the course. We have 100% money back guarantee. Like anyone that's in the course, if you don't pass, we say to you, our promise is, and which we do to all the students, if you don't pass the exam, the paper, we give you back the money. The reason why we have that 100% money back guarantee is because we also have that 100% confidence that we will get you to pass, because we put in so much effort and we know exactly what you need to know to pass that exam. So confidence from us instills confidence in you. So we are ready for the questions. So question number 1, those of you are here for the first time, if you're here for the first time, write down new, N-E-W, just type new. So I could give you guys the rules. Of you that have been here before, then you know the rules. So the rules are, we're going to go through, if anyone types new, these are the rules. So we need to answer the questions under exam conditions, in the sense that I'm going to put a question up and I'm going to give you 1 minute to answer the question. And when you answer the question, please don't type your answer down. Please, every time we do this, we have 1 or 2 people that do it, but please don't do this. Kate says the course is awesome. Thank you, Kate, for that. Is there anyone else that's in the course? Can you guys just type out how you're finding the course? How you guys finding the course? Those of you on the course, just type them for the other people to know how you find this course. Thanks for that feedback, Kate. So yes, so I'm going to go through questions if you're here for the first time, that you're new to the place. Remember, We're going to have 1 minute. I'm going to time you. I'm going to set the timer. Don't type your answer down until I ask you to. Okay? So everyone is ready. Let's start. So I'm going to ask you, me too, new. Yes, Emilia is new. Welcome, Emilia. Adelaide is new. Had is new. Yo is new. So all of you, we're going to do the questions now. Only put your answers when I ask you. All right? So I'm going to set my timer. So I've got about 7 questions for you, and each question is going to be a minute. Some of them will be shorter than a minute. Some might be longer than a minute. Okay. All right. Good, I'm ready. So your 1 minute. Is it too late to join the course? Please ask. It's not too late to join the course. At the bottom, you can go to our website, and we have what we call an automated. So the many people that had the live version. So you have lovely people like Hosna, like Kate, for instance. They joined later. So when you join late, like now, then you get access to all the videos. So you don't have the live sessions because we've done the live course. But what you have is access to all the videos, and you're going to be part of the Telegram group. You're going to receive all this content that we're giving. You're going to get the motivation, the support, so many benefits, right? Just unbelievable benefits. So if you're interested, you just need to visit our website, which is www.preredshortcuts.com, and you could get the combo course. And then we will send you all the videos, and you have access to everything. Loads of BNF videos, summary notes, everything in there. And the Telegram group, you've got tons and tons and tons of questions, and we post things every single day. So let's go. Question number 1. Let's go. There you go. You've got 1 minute, and your 1 minute starts changing. Hosna joined last week. Great. How do you find it, Hosna? Starts now. Okay, stop. Okay. Oh, stop. All right. Hosna says it's awesome. Thank you, Hosna. I think Hosna is a bit different because Hosna is an island, isn't it? Hosna is doing her exam, if I can remember. I think Hosna is doing an exam in August. She's doing the exam in August because an island is still doing the exam in August. So all the best, Hosna. So, guys, what's your answer? I've got different answers. I've got A from Professor. Dovi says A, Yo says C, Chichi says C, Abdi says A, Firestarter C, Amens A. How are you, Amens? Hosna exam in August, that's right. You're going to pass, Hosna. We've got you covered. Rovimbo says C, Ala A. Wow, I'm getting lots of A's and C's. Interesting. Sherwood says A. My Facebook crew, not left you guys. Love you guys so much. You know that. So Miriam C. Anne says C. Shala A. Wow. Elizabeth A. Where is Kate? Kate, what's your answer? Kate has disappeared. All right. Okay, let's see. We've got loads of A's and C's, which is quite interesting. And that's why I said to you guys, be very careful, because this is where the GPH is going to trap you. So let's apply the knowledge. This is a very important part of the BNF, by the way, because I said a lot of questions come in here. You will get questions. And there's so many different ways you can trap students on this. But as I said, once you guys go through the notes, there'll be no issues. So what is the answer? Is it A or is it C, guys? Oh, Kate's got C. All right, yeah, all right. Is it A or is it C? So let's find out. And the right answer is, you guys anxious? Let's go. Boom, C. The correct answer is C. All right. A number of you have put down A. Let's look at the question. Mr. Smith is a black African male who has been admitted to hospital recently for heart failure. Black African male, heart failure. Very important. I need to know that You need to know which medications can you not give in heart failure. You need to know that, okay? He has also been diagnosed with type 2 diabetes and hypertension. The GP would like to start him on a stepwise management for his hypertension. Which medication will be the most appropriate? Okay, the question is asking for the most appropriate. Those of you that put Ramipil, to an extent, you are right, but in this question, you are wrong. And the reason is because it's asking for the most appropriate. Now, if you look at your guidelines, and I put that at the bottom for reference, 2019, your NICE guidelines, it does say if you've got if for Black African Caribbean males, right, or not males, but I mean just Black African Caribbeans, if they've got hypertension and you've got to choose between an ACE inhibitor and an ARB, you go for an ARB because that's the preference. So it says on here, I got that straight from the NICE guidelines as well for you as evidence. When choosing antihypertensive drug treatment for adults of Black African or African Caribbean family origins, consider an ACE inhibitor, consider an ARB, sorry, in preference to an ACE inhibitor. That's the reason why the answer is C and not A. Does that make sense? If you did not know that and you got that wrong and that's clear now, please type in 1, type in 1, type in 1. That's why I said to you guys, be very careful. This is how the GP is going to trap you. So those of you that got C, well done. Okay, let's look at the next question. You guys ready for the next question? Type 2. If you're ready for the next question, type 2, type 2, type 2. Type 2, so I know you're ready for the next question. And once I get the 2s, we're going to go into the next question. Kids, sorry, Lou, break. Now you're allowed to have as many breaks as you want. Oh, my. Okay, great. I've got lots of 2s. You guys are ready for the next question. So next question starts now. Okay, stop. So YouTube, we've got 2 people that put answers down. Please no answers, guys. Please let me say this. Please listen to the instructions because honestly, the many people that failed the exam because when they go into the exam, they don't follow the instructions. So please follow the instructions. Get used to following instructions. Don't put any answers down until I ask you. So I've got Dipti and Michael that put the answers down. Please don't put any answers until I ask you to put the answers out of respect for your colleagues. Okay. There are about 101 people watching on YouTube. If you're learning and you think this is good, just click that like button. Let me make sure that you guys are liking it. If you like that, then I'll know I need to do more of this. So if you think this is cool and I like this stuff, I'm enjoying, that's why I say to you guys, give me a like so that I know that this is actually helping you. If not, then I'll just have to stop. But if you guys are, those of you on, I've got about 100 on YouTube. If you think, wow, this is cool, please continue doing this. Give it a like. And Facebook as well. Okay, so what's the answer, guys? What do you guys get? So I've got 2 Ds already. What do you guys get? Anyone got anything different from D? What do we have? We've got E, A, E. Oh, interesting. So on Facebook, I'm wondering whether it's from the previous question or this is from this question. Okay, so Sherit Kwenda says on Facebook, E. Kwenda, you're on the course, right? Miriam is on the course, I think. You're on the course, Miriam? I think you are. I think you enrolled recently. Kwenda says E. Miriam says D. Sherry says E. So I'm getting loads of D's and E's. We're getting loads of D's and E's. Okay. So let's see. And I've got A for Miriam Langer. A. Okay. Kate says D. All right. Let's see what the answer is. Let's see what the answer is. Wow. If you don't know, just put 0. So the answer, I didn't go through this part with you because what I always do is once I start teaching you guys certain things, I leave certain things out in the notes So they're asking in the questions, and then you learn from the question. Because I want to make sure that you know. So when we look at hypertension, we didn't put that in there, but it's important that you know that for spironolactone, which is like your step 4, you use low dose spironolactone, and a low dose is 25 milligrams. The answer is D. This is how the GPH is going to trap you. Okay, they're just going to change that around and put 50 milligrams, but you use a low dose spironolactone, not 50 milligrams, you use 25 milligrams. So those of you that got D, the answer is indeed D. Well done. Few people had E, not E, right? Not E. Definitely you can use clothalidone. In fact, when it comes to your hypertension, the recommended medications for hypertension are indapamide and clothalidone. They're like the first choice, all right? Indapamide and clothalidone. But spironolactone is 25 milligrams, not 50 milligrams. Great, and those of you are putting 0, thank you for putting that, because then I know exactly how much I need to explain. Joshny and Hadi. Great. Okay, you guys ready for next question? If you're ready for question number 3, type in 3, type in 3, type in 3. Let's do question number 3. Give us a 3 if you're ready for question 3. Great, so we're getting 3, so your 1 minute is going to start now. Okay, stop. So I gave a few more seconds on that one because it's a bit longer. The reason why we say 1 minute per question is because it's good practice for your exam. If you can answer each question in 1 minute, then you have enough time at the end to go through your answers. So that's why we try to get you practicing in 1 minute. But some questions are longer in the exam. They might take more than 1 minute, while some are so short, they're going to take less than 1 minute. But 1 minute, that's why we use that as just a good indication for you to start using for all your questions in the exam. And then those of you on the course, we're going to have a revision session just before the exam. So once we get the date, for Hosna, anyone that's doing it in Northern Ireland, I'm going to send you some information to help you as well. But we're going to have a revision session where we're going to go through exam techniques. And that's really going to help you. We're going to show you how to answer questions within the time, how to go through your questions. Very good techniques are going to help you pass. So what's the answer for that one, guys? What do you guys go for? What do you guys answer? So I've got Chichi says B, Yo says B, Doris B, Hetel B. Getting a few B's. I'm getting B's. Michael Olani says A. All right. MFA says B. Preza says D. So I've got mainly B's, but I've also got an A and I've got a D. Let's go to the lovely Facebook. What we got? Facebook. We've got B's and B's and B's from Facebook. Loads of B's. All right. How many of you, actually, let me see an answer, right? So the correct answer is B. The right answer is B. Those of you putting down B, the right answer is B. So those of you that did not put down B, Treza Fox had D. And I just want to show you guys where you went wrong, okay? So that you can adjust that before your exam. Michael had A. Okay, Michael. Hope you guys can see now. How many of you, just type 1 if you wouldn't have been able to answer this question before, but after the lecture that we've just done, you're able to answer this. Just type 1 if perhaps if you had that before, you would have been able to, but now you did it and you got B. The answer is B because if you look at all of them, and this is how you get questions, you need to know, and this is how they're going to ask you at different targets. So Mr. Brown's clinic, BP 165 over 100, what we said is what step is that? That is 2, okay, stage 2. So we said anyone on stage 2, regardless whether they got organ damage or not, you give them medication. The question is asking you who wouldn't require medication, okay? The only person that will not require medication is Mr. Brown, because it's saying 5%, but it's actually anything from 10%. That's when you actually give them medication. But since they've got 5%, they don't need medication, but lifestyle advice. The others, retinopathy, C145, which is stage 1, but they've got a target organ damage, which is retinopathy, the eye, so medication. The next one, no organ damage, but that is stage 2, and you need to give them medication. So any stage 2 or stage 3 or any stage 1 that has got any organ target damage, you need to give them medication. So well done those that got B, great stuff. Those who did not get B, I hope this is clear now, you understand. So if it comes on the exam, you're going to smash as well. Okay, so you guys ready for the next question? Number 4, type in 4, type in 4, type in 4. So we just have 7 questions. Let's go into question number 4. And the last 3 questions will be pretty easy for you guys. The last 3 ones will be really easy. Okay, you guys ready for 4? Type in 4 and I'll give you question 4. So I'm getting a lot of ones with that learning stuff now. Very good, very good. That's why I'm here. If I did a lecture, right, and you guys left without learning anything, I've literally failed. Like, I want to leave every lecture knowing that you're leaving going, wow, I've learned something new. Because I think that breakthrough is what can make you pass the exam. All right, number 4, question number 4. The time is going to start now. Let me set my time. Your 1 minute starts now. Okay, stop. So I made that a bit tricky because I put down some results. But the reason why I put that in that question is because there are some electrolytes, the results, the ranges that you absolutely have to know. And they always come up in exams. Everyone on the course, I'm going to send you guys a document. It's just going to be a very small document, like an A4. But I'm going to give you a summary of the main ranges that you need to know. So I'll send down the Telegram group probably by the end of this week. And the main ones you need to know, right? Okay. But that's why I put that question in there. Sometimes, or most times, the exam, they might give you the ranges, which will make it easy for you. But I just didn't put that in there because I want you guys to actually know these things off head. All right. So what answer do you guys get for that question, for question number 4? See what answer did you guys get? So I'm getting okay, so I'm getting number of B's, 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 D's, B's, D's. Interesting. I've got C from yours, got C. So I've got loads of B's. I've got D's and the C. Let's go into Facebook. I need to join the group. Yeah, Kate, what are you doing? Kate, get on the Telegram group ASAP. Join the group. You're already on the course. You may as well join the group. You're entitled to join in the group, Kate. Join the family. There's loads of us on there. Let's see. So I'm getting loads of B's, right? I'm getting some C's as well. Ahmed Ekro says C. Sherry D. Kate C. Wow, D's. Wow, this is quite interesting, isn't it? This is a very interesting question because I'm getting answers across the board. I'm getting D's, I'm getting C's, I'm getting B's. So B, D's, and C's are the main ones I'm getting. All right, so to answer this question, I've highlighted key things you need to know for your exam. You need to know your ranges. You need to know what the normal range is for potassium. You need to know that for sodium as well. Absolutely key. All right, so you know whether something's out of range or within range. But those of you on the course, Telegram group, I'll send that out to you. Okay, so let's look at that question very carefully. So it says Mrs. Grant is a 65-year-old Caucasian teacher who's currently taking a few medications for heart failure. So all of these things tell you something. Heart failure, there is a medication in there that you cannot give them. Which one is it? Verapamil. Okay, because that's a calcium channel blocker. So this question is real. That's why many people that's why we're getting different answers, because this is a really tricky question, because there are many different things you need to look into, you need to know. So you need to know your ranges. If you don't know your ranges, you're going to be in trouble, right, of the electrolytes. You need to know about your EGFR. You need to know which medications you cannot give with certain EGFRs. So the right answer for this is C. The answer is C. The right answer, those who have got C, well done. Well done, because this was a tricky one. The answer is C. The reason why the answer is C, if you look at the question, Caucasian, so you'll probably think you will start off with an ACE inhibitor. Okay, you think about an ACE inhibitor. But with this patient is currently taking a few medications for heart failure that rules out verapamil. Now, when you look at the EGFR, which is 25 mils, for thiazide diuretics, anything that's less than 30 mils, those are put a bit, you cannot give them for thiazide diuretics if the EGFR is less than 30. So I'm just going to see if I could go back very quickly just for you, just very quickly, to that amazing table I was talking about. So if you look at this table, thiazide diuretics, you need, which is number 4, you need to avoid in diabetes or gout. Gout is one of the main ones. And also, if you have an EGFR of less than 30 mils, you need to avoid thiazides. Now, when you look at this question, if you're going to do it, you probably think, looking at this, following the guidelines, you got a calcium channel blocker, but you cannot give a calcium channel blocker to that patient because that patient's got heart failure, or had heart failure, so that rules out a CCB. Your next thing you've got an ACE, or you've got a thiazide. Some of you might go a thiazide diuretic, but you cannot give a thiazide diuretic because the patient has a EGFR of 25, which is less than 30, so you cannot give them that one. What you can give them is an ACE inhibitor. That's the next. So if we go through the process of elimination, it's going to be your ACE inhibitors. That's why we've got ACE inhibitor. So if you didn't know indapamide, for instance, was a thiazide diuretic, you're going to be in trouble. And also, if you didn't know about the EGFR, then you're going to be in trouble. Is that clear? So those of you that got C, that's why the answer is C, process of elimination. Great stuff. But that was a tough one, I must admit. That was a tough one. I dropped that in there to make it hard for you. Okay, so the next one, we're going to have an extended matching question. So there's going to be 3 in 1. I don't think you're going to need 3 minutes. I'll probably give you guys 2 minutes, and then we're going to stop, because I think most of you will be able to do it within 2 minutes. So are you guys ready? If you're ready for the final questions, just type in question number 5. Let's just put 5. Type in 5. If you're ready, type in 5. Remember, if you have any questions, please type the questions in, or just send me an email. I'll be very happy to explain it. If you're not clear about anything, or you need any clarifications about anything, I'm more than happy to spend that time with you and to explain anything to you. Okay, so if you guys are ready, just type in 5. Okay, so Ahmed is asking, can I explain why not D? Okay, so we'll talk about the most appropriate. So when you talk about D, you're looking at, normally, when you use spironolactone, it's normally when you have resistant hypertension. So you've tried all the other steps, and that's what we're talking about. This is just for Ahmed, because Ahmed asked a question very quickly. So Ahmed, if you look at where this comes in, spironolactone comes in at step number 4. And that normally happens when you've done all the 3 steps and you've maximized the dose. So you've used optimum dose for your A's, for your CCBs, for your thiazide diuretics. Then and only then do you bring in spironolactone. Okay, so that's why, and we're looking for the most appropriate, but we haven't used an ACE yet. So there's no point giving a spironolactone when you've not used step 3. So it's like jumping to step 4 without doing step 3. Okay, very important. So someone's asking, I thought you give indapamide in heart failure. Yes, you can. But in this case, you cannot give indapamide because this patient is not the heart failure. The heart failure just rules out the calcium channel blocker, which we have. But in this case, it's because the reason why you cannot give indapamide is because this patient has an EGFR of 25. Because that's why you cannot give an indapamide. And the reason why you cannot give verapamil is because this patient has got heart failure. The reason why you cannot give spironolactone is because that's step 4. But you've got ramipril. The question is asking for the most appropriate one. Great stuff. Okay. Right. So, guys, ready for the next question? Your next question, I'm going to give you guys 2 minutes for this one because I'm not going above time. 2 minutes, and then boom. There you go. Starts. The 2 minutes starts now. Okay, stop. Okay. Someone asked a question. Chichi asked a question, but deleted the question. But I've seen the question before, and it was a very good question. And the question was, I thought you cannot give ACE inhibitors in severe renal disease. So in this case, I was just going to say a low GFR 25 is not severe, and the GPhC will tell you, it's severe renal disease. This is not a severe renal disease. Okay. The low eGFR of 25 is not severe renal disease. But that was a good question. That was deleted. I just about answer it. So what do you guys have? Let's go. The first one, question number 5. What was your answer? So 25-year-old lady with preeclampsia was 20 weeks pregnant and she has no other conditions. What do we get for that? So I've got HGB. Wow, all answers HG. So the first one, the answer is H, correct? So the first one is meta-dopa, which most of you got. Good to know. What about the second one? What do you guys get for question number 6? So I'm getting G. Okay, so a 45-year-old Caucasian male with type 2 diabetes and ankle edema who has had ramipril and his BP is still high and the GP wants to add a new medication. What did you guys get? What did you guys get? So for this one, G. So someone just asked a question from YouTube, which again, I said you guys need to be very careful with this stuff, and people get confused. I think CJN, but the patient is 65 years old. Why Ramipil? Okay, this patient is 65 years old, Caucasian male. Why Ramipil? Guys, remember what I said about diabetes? This patient has type 2 diabetes. So what's the first step for them? It is an ACE because they've got type 2 diabetes. So be very careful, CJN. Very, very careful with this stuff. But the answer is G, is clothalidone for that one. It's clothalidone. So if I got G, well done. Because I said the patient, Caucasian male, type 2 diabetes and ankle edema, who's had Ramipil. So if you have Ramipil, high BP, and GP wants to add a new medication, the next one will be your thiazide. Diabetes. You cannot give them a CCB. You could have gone calcium channel blockers probably, but unfortunately, the patient already has ankle edema, so you don't want to give them a calcium channel blocker. The next choice will be your clothalidone. All right, and the final question, what do you guys have for number 7? The final one for number 7. Great, I'm getting some good answers there. So number 7, which one? That should be an easier one, I think. So number 7 will be B. So these are the signs of gynecomastia, and that's caused by spironolactone. Okay, so most of you got that B, which is good. So that's it, guys. Thank you so much. Sorry for going above time. But next week, we're going to cover beta blockers. And as I said, most of you are asking about the course. You can still access the full notes. You can enroll on our course. All you have to do is visit the website, preredshortcuts.com, and then get the combo course, and we'll send you all the notes in detail, and you'll be part of the Telegram group. Okay, so Simdi says, please explain the use of calcium channel blockers in HF. I thought it's only contraindicated in rate-limiting channel blockers. Okay, so I'm going to answer this for you, Simdi. So Simdi is asking about the use of calcium channel blockers in HF. So in heart failure, calcium channel blockers are contraindicated except amlodipine. And sometimes they say as well all your dihydropyridines, because they don't act on the heart muscle, they act on the blood vessels. So in that case, but remember, the ones that are rate limiting, which are, yes, contraindicated, are your verapamil and diltiazem, because they act on the heart muscle. But at the same time, it says mainly you want to avoid calcium channel blockers in general. But you can give amlodipine. You can give amlodipine. In some books, it says you can give a range of even your dihydropyridines, because they don't act as much on the blood vessels. That's why if you see most of the examples as well, I've just, in order not to confuse you, I've put verapamil. In this one, for instance, that's verapamil because it's a rate-limiting calcium channel blocker. I knew if I'd put maybe amlodipine, people might get confused. But to an extent, you can use amlodipine, but you cannot use verapamil or diltiazem. Thank you very much, guys. I hope this helped. Thomas says, thank you. If I enroll to the course now, do we only have access to June? No. If you enroll in the course now, you have access for 4 months. In fact, almost 5 months, because what we've done is you have access for 16 weeks, but we've decided that because of the extension of the exam, you will still have some more access a month before the exam. On top of that, you will still have the support, the revision all the way through. So it's better for you to get on it now, because you're going to maximize your benefits. So you have 16 weeks. In total, you've got 20 weeks. Okay, so it's not end of June. We'll have to update on the website. That was previously for the students that are on there. For you joining in now, is 16 weeks, okay? Because everyone that is on the course now, they will still have access a month or so before the exam. And throughout this time, we're still going to continue the revision. We're still going to be working together. We're still going to be training you. We're still going to be pumping up your knowledge. So it's best to get on it now. Thank you, guys. Thank you so much for your time. Thank you so much. I hope you guys enjoyed this. Share this with friends. Share this with colleagues. Join me again next week. Join me next week when we're going to cover beta blockers. Hey, everyone, have a great evening, and I'll see you all next week. Any questions, just send me an email.